Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Agents used nowadays in pregnancy are pancuronium, vecuronium, and atracurium. First, pancuronium. Pancuronium has maximum vagolytic action. It has current use. So, because it has maximum vagolytic agent, it causes tachycardia and it is cardiac unstable. Pancuronium increases the catecholamines, thus it can cause hypertension. So because it increases the blood pressure, so pancuronium is used in shock. In shock, the muscle relaxant, so used in shock is pancuronium. Agents in shock. The muscle relaxant used in shock is pancuronium. Intravenous anesthetic agent used in shock is ketamine. Inhalational anesthetic agent used in shock is desflurane more than 6%.
Summary: Pancuronium is the most vagolytic agent and it increases the heart rate, so it causes tachycardia and cardiac unstable. It increases catecholamine release, thus causing hypertension, so it is used in shock.
thank you and thank you for watching.